Hey gang, so chapter 5 this week, we are going to be talking a lot about cultural competence. Chapter 5 is entitled Respect for Persons and Diversity. One of the first concepts talked about in chapter 5 is cultural competence. Okay, so Principle 2B in the APTA Code of Ethics states that physical therapists, and I'm going to say PTAs also, shall provide physical therapy services with compassionate and caring behaviors that incorporate the individual and cultural differences of patients or clients. Now, CAPTE, who is our accrediting body for Whatcom Community College, CAPTE defines cultural competence as, so they state that, this is directly from your text, states that culture refers to integrated patterns of human behavior that include language, communications, actions, customs, beliefs, values, institutions of race, ethnic, religious, or social groups. Now, competence implies, again, this is directly from your text, having the capacity to function effectively as an individual and an organization within the context of the cultural beliefs, behaviors, and needs presented by consumers and their communities. So if our accrediting body defines cultural competence for us, we're going to talk about what it means for the PTA as we apply that. Okay. So I love this. I don't know who wrote it, but we could learn a lot from crayons. Some are sharp, some are pretty, some are dull, some have weird names, and all are different colors, but they all have to live in the same box. So appreciating diversity involves developing competence and a willingness to interact in desirable ways with members of other cultures. So how do we do that? How do we facilitate an ethic of care? We need to identify the beliefs we hold, the beliefs our patient holds. We need to identify the same for ourselves and our patient, the values, different ones we each have, and the different health attitudes we have and our patients have, okay? This includes different dimensions of diversity, includes power and privilege, and cultural considerations. So we're going to explore those all. In your text, starting on page 63, there are 5 cases that explore all these concepts, and hopefully, if you, hopefully you're already working on this, reading The Spirit Catches You. I know at least one student's handed that project in already. That's awesome. But don't wait too long if you haven't started it yet. As you're reading The Spirit Catches You book, you're discovering these strategies in your reading, or discovering how maybe these strategies didn't get implemented, okay? So diversity refers to human qualities that are different from our own and those of groups to which we belong, but that are manifested in other individuals and groups. So dimensions of diversity include, but are not limited to, age, ethnicity, gender, physical abilities or qualities, race, sexual orientation, educational background, geographic location, income, marital status, military experience, parental status, religious beliefs, work experience, and job classification. So that's a lot. The center of the wheel here represents internal dimensions that are usually most permanent and more visible, okay? The outside of the wheel, the lighter purple, represents dimensions of diversity that are acquired and change over the course of a lifetime, maybe change over the course of a lifetime, often do. The combinations of both of these, the darker purple and the lighter purple, all of these dimensions influence our values, our beliefs, our behaviors, our experiences, and our expectations and make us all unique as individuals. So the tip of the iceberg, what we can see on the surface of our culture, how our food of our culture, flags, festivals, fashion, holidays, music, performances, dance, games, arts and crafts, literature and language. But there's a whole bunch more below the tip of the iceberg here when we talk about culture, okay? We have to consider different communication styles and rules that a certain culture may have. We talked about this a long time ago in 101, just a little bit here, kind of revisiting this. Remember, different cultures have different ways of expressing themselves, like eye contact, facial expressions, different gestures can mean different things in different cultures, personal space, touching, body language, even tone of voice, how we handle or display emotion, different conversational patterns, okay? You can kind of look at these all on your own. I'm not going to read them through all to you, but know that there is a lot that affects culture in all of these areas, okay? And different cultures are going to approach situations differently based on their attitudes towards all of these, their notions of these, their concepts of these, their approaches to these, their different communication styles and rules, okay? This is kind of interesting. I took some data from physical therapy programs, and just regarding ethnicity, this is just kind of more fun for you to know type of stuff. Check out how many folks in a PTA program are Caucasian compared to how many are American Indian, okay? There's a big challenge at the college or university level to increase or balance the ethnicities and gender of PTs and PTAs. So yeah, how can we outreach? How can we support more diversity, even in just the ethnicity of enrolled program participants? Okay, so some things within culture to consider. Talk to you a bit about the biomedical model. Now, the biomedical model is the one that Western medicine follows. Traditionally, the biomedical model is characterized by valuing technology to conquer disease, by gathering diagnostic data to relieve symptoms and cure disease, by embracing individual autonomy, by valuing timeliness and efficiency, by deriding alternative or complementary practices, that's a bit of a bummer, and by traditionally characterized by using the English language with exclusive medical terminology, okay? So I want you to think about these things as you're reading through the Spirit Catches You book, knowing that, the doctors and the healthcare professionals in that book are all operating under the lens of the biomedical model, okay? And the patient's family is certainly within a different lens. I don't want to give away too much of the book if you guys haven't read it yet. Excuse me. So the biomedical model does make certain assumptions, okay, based on what is traditionally characterized by, but we're finding as you're reading through Spirit Catches You, you could say that the biomedical model, the Western medicine model, clashes with a patient's subculture when the patient is expected to be compliant and grateful, when the patient is expected to use English, when the patient is expected to be timely, when the patient's expected to be the primary decision maker in their own healthcare. Now, this refers to a bit of the patient's family in Spirit Catches You here, okay? Also clashes when the patient's expected to accept that disease is the basis of all illness. That's a huge clash for the family represented in Spirit Catches You. And when the patient's is expected to use established medical practices to conquer disease, also big clash that you're finding in the book. We're seeing many of these examples throughout Spirit Catches You. Okay. Now, physical therapy is considered to be a subculture of the Western healthcare system. So we do operate within that biomedical model, okay? So subculture, much like, massage therapy is, much like even nursing is, athletic training, maybe even like acupuncture is starting to be more accepted in the Western healthcare system. That would be a subculture, hopefully becoming more and more widely accepted in the Western world. Physical therapy knowledge is so in the fact that we're a subculture of the Western healthcare system, that assumes a few different things about our professional culture, okay? That physical therapy knowledge is learned in a professional educational program. That physical therapy as a discipline has its own distinct value system and beliefs. That the physical therapy discipline has expected behaviors and language. Excuse me, this is a joke, but I used to say that it has an expected dress code too, like what, all PTs wear khakis and a polo shirt? I don't know. The physical therapy has its own values, beliefs, behaviors, and language, and that's going to be transmitted from one generation to the next. So like one generation of PTs to the next generation of PTs, okay? So how do we develop cultural competence, okay? So on page 65, there is this quote that says, "A variety of approaches have been developed to understand and foster cultural competency. Cultures in general can be sorted into two categories. So individualistic puts the focus, so the individualistic cultural category puts the focus on autonomy, patient's autonomy and individual rights. Also focuses on competitiveness and planning for the future. The idea that time is precise and focused for the best use of time and productivity." Okay. And you can read through these in your text also. The collectivist cultural category focuses more on group well-being and interactions, cooperative communities with traditions that connect to the past, present, and the future. More of the idea that time is fluid. Communication, both verbal and nonverbal, are highly valued. Okay. So very different categories between different description of the two categories. They're almost innately different, I think. So how do we develop cultural competence? Okay, first of all, stage one, we need to develop a knowledge of ourself. Hopefully that's something you've been doing ongoing throughout this program, and knowing your own biases, okay, and how your own self is influenced by your culture and your beliefs. So I don't know if you remember me talking about way back in 101 how, I consider myself middle to upper class Western culture, okay? So I'm going to view everything through the lens of those glasses, okay? That just is. You are going to view things through your own lens, all right? And your patient may have a different lens with what they're viewing things through, okay? So that's the first stage. Develop knowledge of yourself and how yourself is influenced by your culture and your own personal beliefs. Step two then is to develop an awareness of the idea of people who have their own values and a willingness to treat others as they wish to be treated, okay? And stage three is to develop the ability to empathize with and respect individuals who have a different worldview than yours. And I haven't seen you guys in a while, but I feel like mostly everybody is, coming into this stage three of developing cultural competence. Hopefully you'll have more practice with this as you get to your final clinicals, but that you are personally going through all these stages and developing the ability to empathize with and respect individuals that do have a different worldview than yours. Okay? And if you're not quite there yet, maybe you're in somewhere into stage 2 and you are, learning to keep your mouth shut when you are facing a person with a completely different worldview than yours because you're maintaining professionalism, yes, and maybe then moving on to developing empathy for them, okay? Some things that can influence our cultural competence, okay? Prejudice is making a judgment based on prior experience. Ethnocentricity is judging another culture solely by the values and standards of your own culture, okay? Judging somebody by their race. This is identification based on appearances. Versus ethnicity is identification based on the region or the ethnic area that they live. Okay, so also too, excuse me, I skipped a couple. Some other things that can influence our cultural competences, how we view people with disabilities, or if we maybe are having a little bit of a sexist viewpoint. Okay, so how do we bridge cultural differences? Okay, there's 3 models: explanatory, the learn model, and the ethnic model. There's some case studies in your text that start on page 67. As you're reading through those, I want you to try to identify which strategy might be helpful for a PTA to use, and also as you're reading, the Spirit catches you. But here they are. So the explanatory models, or EMs, are the notions about an episode of sickness and its treatment that are employed by all those engaged in the clinical process. The interaction between the explanatory models of patients and practitioners is a central component of healthcare. So notions about how the episode of sicknesses and treatment goes, okay? So fairly straightforward. So the explanatory model asks these questions: how or why has the problem occurred? What's the cause of the problem? What else might cause it? How might other people in your family explain the cause of the problem? And how might other people in your country explain the cause of the problem? Okay, so typically we have a agreed upon consensus. Say, just take like rotator cuff tear. Okay, we can answer those questions pretty straightforward using an explanatory model. Okay. So the learn model gives guidelines for overcoming obstacles in cross-cultural communication with patients. So learn stands for listen with empathy and understanding of the patient's perception of the problem. Explain your perceptions of the problem. Acknowledge and discuss the differences and similarities. Recommend treatment, and negotiate treatment. So maybe you can see that maybe this model might have been a good one to employ when working with the patient and the patient's family in the Spirit Catches You book, huh? And the ethnic model may have also been a good one to consider in the Spirit Catches You. So also a acronym. So ethnic, ETHNIC, stands for explanation. How would this person explain his or her illness? Yeah, maybe they don't think that epilepsy is caused by a neurological condition. Okay. Treatment, ask the person what kinds of treatment they have tried. Healers, have they sought any advice from healers? Negotiate. See if you can together negotiate any mutually, underline mutually, acceptable options. Intervention. Agree together on the intervention. And collaboration with the patient, with their family, and with any healers they have sought advice from. So you can see how maybe that's the ethnic model and the learn model are maybe a little bit different than the one we typically utilize for in the explanatory model, kind of Western medicine. Anyway, 3 different models that you can use to help bridge cultural differences and help develop and grow in your cultural competence. All right, guys, that's it.